Hello and welcome to India. Welcome to the 37th annual camp for the Sri Sarvado Bidra Trust. Again, this is a free charity organization in which everything is provided to the patients without any cost. We're in a very remote part of India. This is the northwest part of India in the state of Gujarat, and the regional area is Kutch. It started just in tents as a very low operation, and now it's moved up to a full modern-day hospital. Let's take a look at what's going on here. Welcome to the 37th annual Endocrinology camp. They're going to be doing mostly diabetic screening along with thyroid screening. There is, again, a very high incidence of diabetes and thyroid pathology in this area of India. I'm with Dr. Praveen Mehta. He's a physician coming from the United States, from New York. He's an endocrinologist. He's here doing diabetic counseling during our endocrinology camp going on.
We, in fact, provide them with the medications, sometimes free, because they can't afford to buy these medications, and also advise them to come here on a regular basis to get their blood sugars monitored and then get appropriate medications.
This local village man that he's been doing some diabetic counseling with right now has known he's been diabetic for about the last 20 years, but over the last month he hasn't had the financial resources to be able to afford his diabetic medication. So along with doing our blood work testing, we're also supplying him with free medication, all paid for by the trust. Thanks for your hard work. This patient is a local village lady that has a thyroid goiter. Dr. Mehta is just kind of palpating to find the size of her goiter. She has hypothyroidism, so he'll also give her a prescription where she will get back on her thyroid medication and they'll be able to monitor it. Hi and welcome to the camp for asthma and allergy treatment. We're at the 37th camp this year. This is the 17th time that the asthma and allergy camp has run. Patient education and awareness is one of the biggest parts, and just getting the word out about what allergies are, what asthma is, and how simple it is for them to treat them to avoid major medical complications. This is Visan Nadia. He's a doctor. He's an allergy and asthma doctor. He's here educating the local community people about the effects of allergies, the cause of asthma, and how to go ahead and self-manage their own symptoms. There's a high smoking prevalence in this area of India, so he's also educating about the effects of cigarette smoke on patients that have asthma. He's now describing the two different bronchial tubes. A normal tube, and then the second tube is a tube, how it's affected by asthma. This is Dr. Naga. He's here doing a consultation with a local village man. Before the camp began, they go into the village and they distribute pamphlets and provide counseling based on what the symptoms of asthma and allergies involve. Then the patients who are interested come and get a free consultation here. This is called a rotohaler. He's teaching the patient how to use a dry powder inhaler, or DPI. So we're measuring his pulmonary functions. So he's doing an inhalation right in there. The machine's going inputted into the computer. The computer is able to process along with his age, weight of the patient, and then we'll be able to determine the level of restriction that the patient has in their lung function. Once the doctor has determined what the right course of action is, the medication is distributed here free of cost to the patient. I'm with Bachchu Bhai. He's one of the founding members of the trust, and he's been the chairman for the last 20 years. I'd just like to ask you a little bit about how the trust started and how it developed into such a mega camp.
At least 37 years ago, there was only eye camp, including dental camp. We had not a pakka building or anything. It was the small rooms where they operated the patients. It started for 15 days. And that first experience, the results were very, very good. People were so happy. Every year we were organizing. Third year it was 1,000. Then again it was 1,400 people were operated. So we were surprised that this is the best thing we should do for the society. Last year we opened a naturopathy hospital consisting 100 beds. We thought of physiotherapy. This is a very up-to-date physiotherapy hospital where we are standing. And recently, about 2 months ago, first floor was also opened for the patients. So now we have got ground floor and first floor building.
Thank you so much for your years. Really, the people of Kutch would have no medical supplies and services if it wasn't your years of dedication. Thank you so much. This dermatologic camp has about 200 patients that are going to be seen today. This is done just on an outpatient basis. Dr. Wagdare, who's associated with the Maru Hospital in Mumbai, has come up. She does consultations, and if there's any more invasive techniques that need to be done, they'll be treated back in Mumbai. Here the patients will be evaluated, and conservative treatment of medication will be administered, again, all free of cost to the patient. This patient has received his consultation from the doctor. He's now being given free medications to be treated conservatively here at the hospital. This full-time dental clinic was established in March of 1986, 25 years ago. Previously, we used to just have mobile dental units that would go village to village once a year and provide dental service. This whole facility has been remodeled in the last 3 years with all the modern dental facilities available in the West. I'm with Dr. Rohit Savla. He's been the head dentist of this department for the last 25 years. There needs to be a lot of education in this part of India in the dental world. So how have you tackled this job of educating the local village people about proper dental care?
Now many patients are coming for saving their teeth, and even we used to educate about their oral hygiene, to brush twice daily, gargle, and to come regularly for every 6 or yearly for cleaning up their teeth. So gradually awareness has increased.
All the services here are provided at a very low fee to the patients. The average cost of a complete crown is $18 US, and a root canal is around $9. If the patients are unable to afford the dental work, they can meet with the trust, and we will provide it at a reduced rate or free of charge. One of our other programs we offer here is counseling and cancer awareness screening. As part of our complete medical care that we're trying to offer, preventative medicine is also a major focus. There is a high incidence of patients using chewing tobacco, and I've heard many stories of people starting chewing tobacco at the age of 6 or 7. So increasing the awareness and education about tobacco products. We have a smoking cessation program, and we also have a breast self-exam program. This is Neelam Parekh. She's a local woman from Mumbai that's coming up volunteering. Her son is actually an inpatient at Jaya Rehab. She's taken over the cancer smoking cessation program. She's trying to educate the local village people about the dangers of tobacco. This is Dorothy Beda. She's from upstate New York, but her husband's local village is right here in Bidada. She's been doing breast cancer screening for the local women. She's screened over 450 women, and of the 450 screens she's done, 12 cases she's found suspicious nodules, and they've been referred to come back to the gynecology camp. Once Dorothy's finished the physical exam, she comes out and she counsels the patients. She has a small model of a breast that has a lump in it, and she teaches them how to do a breast exam using the small model. Now you can understand the hard work and manpower that goes into putting together a mega medical camp in a rural part of India. All the doctors in this movie are volunteers. All the medical care is provided absolutely free of cost to the patient, including medicine and follow-up care. We appreciate your donations and hope for your continued support.